Hi everyone, we're here with chapter 15. We are almost done. We're moving into middle adulthood, which some of us are in, very few of us. But first, of course, we typically start with the physical and cognitive development, and then we move on to emotional and social health. So we are going to do an overview of the physical and cognitive, and that will help to keep you focused on where we are. So middle adulthood, sadly, occurs somewhere from mid 30s to 40 up to 60 to 65 years. So that's good news for me. I guess I'll be here for a while because I'm only 42. Middle adulthood describes a group of people ranging from baby boomers to Gen Xers. I'm a Gen Xer, meaning there are vast differences in generational characteristics, upbringing, education, and experience. And we know that. We hear a lot about baby boomers and Gen Xers. Those baby boomers are the ones who were experiencing Vietnam, civil rights, women's movement. Those 44 through 64 is a lot different. It's interesting to me now to think about, the impact of the pandemic. It's probably similar to some of the things these boomers went through. They are typically optimistic, independent, and idealistic. Where Gen Xers, that's me. I just did make it. Well, no, I didn't. I was 1977. So um, we were influenced by our parents, by the boomers, but not as socially conscious. But I think it's interesting to me because I think that's probably changed with a lot of us. Perhaps we weren't because we didn't have to be when we were young because things weren't going on like they were when our parents were growing up. So we're independent and very self-reliant. I do agree with that. This stage, wink, wink, is probably going to be a test question. Erickson's psychosocial stage, generativity versus stagnation. Remember, I keep talking about that, and you need to memorize those and know them, and you need to understand what the terms mean, and you need to understand what the crisis is and how to resolve the crisis in that stage. So generativity is what it sounds like generating a life. Basically, you are giving to others, you're helping others, you feel successful, you feel productive, right? You're generating. That's a way to remember it. And first, it's like a stagnant little pond of water. That's what stagnant means. I always think of. I used to talk about with the drug court clients. I used to say when they're like a stagnant pond, and everything freezes. The world continues to move, but they are stuck. And then when they get in recovery, they get out, and the water is moving like a river, and they're moving forward. So that's my metaphor for that. But when people are stagnant, you'll see this in the practice. People like this. They feel like they're not contributing. They feel lost. They feel like they're not generating anything worthwhile. And those clients are really tough in therapy sometimes. They have a lot of trauma, complex trauma, a lot of unresolved prior developmental stages, and whatever your theory is or you're thinking of that maybe, and they feel lost. And so it's your job to help them to figure that out and to see if that's even a goal, because sometimes people come in, they're stagnant, and that's not what they're there. But perhaps that's something that's going on, and you need to write a plan for them to help them to address that. Aging's inevitable. And I think in your book, and we talked about, the amount of money that is spent on plastic surgery and Botox, and it's unbelievable, right? Um, Not judging, because here I am in that stage. I haven't done anything like that yet, but I get it. I get it. We start to have these primary aging and secondary aging, which are other age-related changes due to disease, poor environmental conditions, or lack of health care. But just have to look around to know how many people try to fight that in this age range, right? So, physical development. There's external aging. So a lot of this chapter is pretty self-explanatory. So it would be easy read for you, but it's important for you to understand what happens in this age development if you have never lived it. This is where you start to see those changes, right? That you're losing the elasticity in your skin, sagging, your sun exposure starts to come up, your hair turns gray. My hair is turning gray. Hair loss, alopecia, which is hair loss, weight gain, poor metabolism. 1/3 of adults are obese, and that, of course, has a big effect on their health and their lifespan. and our bone density already begins to decrease at 25, and our muscle mass starts to deteriorate. So it's really important to try to encourage healthy options for people in this age range to keep them as healthy as possible. And everything just starts going downhill, like your vision. I think I'm about to start to need reading glasses, which I'm kind of excited about because I used to wear glasses. Fun fact, I had LASIK surgery right after I had Helen because I didn't mind wearing my glasses. I couldn't see far away and I had contacts, but I had an aversion to the contacts where I couldn't wear them anymore. So I didn't want to wear glasses 24/7. I didn't mind wearing glasses sometimes. I liked them actually. But you would have seen me 10 years ago in glasses quite a bit. That would have been a norm to see me like that. But I didn't want to wear them when I worked out and swam. I just didn't want that. So I went and got LASIK and it was great. And I can still see far away. But lately, I've been having a little bit of trouble seeing close up. So you may see Dr. Veal in some glasses in the fall, so that'll be fun. Let's see. Oh, yes, I don't know how to say what my problem is here, but presbyopia? Maybe I don't have my phone to do my little Google to see what it sounds like, but it sounds presbyopia. That's my problem. And other, and presbycusis? Oh, all right. I'm going to pause it so I can go find out how to say that. It's bugging me. Hey, just so you'll sound smart in the future, even because we're not optometrists, presbyopia. Presbyopia is the first one, and let's do the second one. Let's see. That would be presbycusis. Some of you may have known that, but I have never heard age-related hearing loss as presbycusis. But now we will all sound very, very smart if we need to talk about it. But our clients may have no idea what we're talking about. Speaking of which, if any watched the school board last night, I felt so bad. I don't know if any of you, probably none of you listened, maybe a few of you, but of course I did because I have children to find out what is happening in the fall and how is this going to work. And they are going to have school and it's all going to be very, very different. And then we're also going to have an online, like a virtual option, which is the same that's going to be true for all of you. If you need to go virtual at any point or need to stay virtual, you can. And some of you are going to be on that track, and that will be fine. So in the presentation, one of the presenters kept saying asynchronous and synchronous learning instead of online and in seat. Now, I even had a hard time following for a while because it's the same word with an A. If you keep saying asynchronous versus synchronous and synchronous versus asynchronous over and over, it can be quite taxing. And I felt terrible because a lot of people are not highly educated and may have never even heard the word synchronous. So I didn't know if any of you heard it, but I thought, we really need to be mindful of our audiences when we're speaking to people. So we wouldn't want to use big words like this in counseling because our clients probably haven't heard of that word and you don't want to make them feel bad. We want to always be mindful of who we're speaking to in our audience because a lot of people may not be highly educated and even those who are may have a hard time with language such as that. Okay, off soapbox, moving back. Unfortunately, our taste buds also can be affected and your smell. I mean, it is just looking really good for me, guys. I'm just telling you, it's looking great. Everything is just so exciting. Right? I'm losing everything. I'm going to get gray hair and gain weight. Woohoo! Oh, yeah. And of course, middle adulthood is when you start going through menopause and not reproducing anymore. And people usually may have to have help having children with assisted reproduction technology. And there was an interesting I don't know if you saw the 70-year-old that was able to have a baby in India in your text and it said it's really controversial because then she wasn't well enough to take care of the baby. And so it's an interesting concept when you get to a certain age, it could be hard to care for a child. So also at some point you may consider things like a uteral ablation or hysterectomy. And why in the world are we having a health class? Oh, you can't answer me. That's right. Ha. I do miss that. So, of course, you're going to get clients who come in who are dealing with these things. I do a lot of women's health, and I'm armed and ready to give information to my clients. Most of my clients have not heard of an intramural ablation, but I'm really happy to tell them about options. I love to give them options. I mean, sometimes all doctors are not cracked up, uh, are not what they're cracked up to be, and often we find our patients are not getting good care, and they're coming in, they're going, well, I have to have a hysterectomy, and I'll say, I don't insert anything, but I say, have you explored all your options, and are you comfortable? Tell me more about it, and they'll say, well, that's my only option. I'll say, well, did you just discuss other women's health options like ablation? And often they'll say no, and I'll say, well, maybe you should look into that. So of course I put it in their court, and I don't lead them or give advice, but I do give information. I think it behooves us to be educated, and this is a huge issue. Women can have a ton of adverse reactions prior to and after. If they have a hysterectomy, it can be very difficult for them. Also, menopause. I have a couple clients in it now, and they have a lot of symptoms: sleeplessness, mood change, fatigue, rapid heartbeat, nausea. I have a client. Oh my goodness, she had some other stuff too. I mean, work through that, but I've been working with not only her OBGYN, but another primary care, a psychiatrist, a psychologist, and myself. We've teamed up to help her, and she's better. Um, and it's taken a team approach to address her meds and to address her mental health. And now she's doing great. But a big chunk of it was menopause. So if you're not aware of that, and you get a woman coming in this age, typically between 45 and 55, and they're going, I think I'm going crazy. I can't sleep and I'm hot, and you need to know that could be what it is. And the medical part of what we do is really, really, really important. And same for men. A lot of men, their health is less affected, of course, than women, because a lot of times back here with women, um, a lot of times they're having issues with their with period. They're having their menstruation cycle is really off or heavy, spotting, and it's causing a terrible quality of life for them. So this is why they're going into these, making these decisions. Okay, so for those of you who are not aware, that's why. And then men don't have as many problems like that. They do lose their sperm count. They can reproduce later in life. Their testosterone goes down. You see those commercials about prescribing testosterone and stuff like that. But also, high testosterone um, can also cause prostate cancer. So, fun fact there. So, sometimes you get all these things when people come in, and then often couples who are deciding they don't want children anymore, they decide that maybe the man will get a vasectomy so they won't have to do birth control anymore, which could be problematic for women after 35. It can cause cancer. Let's see, and erectile dysfunction. That is hands down one of the most significant issues that I deal with, and that you will deal with. If you do couples, you do men, you do women, you'll have women come in and say, my husband, he can't have sex anymore. And you have to be ready to talk about that. How do you feel about that? And what can we do about that? Can we get y'all to marriage counseling? Have you seen the doctor? There's things that we can do about this. Bring him in. Let's talk about it. You don't want to change your role from individual to couples, but you certainly can invite him in to do some psycho ed and talk about like what's a treatment plan, like how can we get this, how can we work on this, because it can cause a lot of issues. Men can have this happen fairly early in their marriage, and it can be problematic, and so it can be a lot of shame. So you got to get comfortable with just talking about it so that they don't feel bad and they feel comfortable talking to you about it. And I don't mean just in heterosexual relationships either. All men have this issue. So I didn't mean to say a wife, just a wife. It can be any couple. I wanted to be clear about that. I just predominantly, we live in LaGrange, so I've just seen a lot of women and men who are in heterosexual relationships. I'll say that. Masters in Johnson. I read their textbook. I took a sexuality course in my master's program. And contrary to what you may believe, older adults do have sex and have good sex lives. It can be longer for men to have an erection and can have more time for them to recover before they can have sex again. Also, you may see the KY jelly commercials. That's the vaginal walls thinning for women. They're targeting that age range because of that reason. So it's important for you to understand lubrication and why that could be helpful for sex, especially if you guys are doing couples. you're going to need, this is going to be a huge part of what you talk about, and you got to get comfortable with it. I was not comfortable when I first started, so I get it. Um, I just remember I did, but it took me some time as a new clinician to get used to all of that. Um, at first, and then now I can talk about it as the day is long. But um, sometimes they look at me like I'm crazy. Like, how's your sex life? That's a common question for marriage counselors, sex therapists, and even a regular therapist. It's important for you to know what's happening there. It can be a huge issue. Another thing, I hate to say this, I don't think this is in your PowerPoints, but often when couples are not having sex, one of them could be having an affair. So it's not necessarily all the time. It could be this, and you want to find out what is going on, right? And why haven't they addressed it? Because there's so many things that people can do these days to have a fulfilling sex life. Okay, we've talked. It's a good thing I'm not like Dr. Ruth or whatever here, your sex therapist. But if any of you are interested in being a sex therapist, you would talk about this all the time, and you would probably have a thriving practice. Of course, birth control is not as much of an issue because we're not reproducing, but sometimes you can, and that can be 55, etc. So just knowing that. It's just fun. This it's just so fun to talk about this, right, guys? It's just here we go, more organs, organs failing, hypertension, high blood pressure. Of course, high blood pressure is something you have to get checked. Um, Cardiovascular system may be compromised. Um, the amount of air the lungs inhale and expels is diminishes in the 40s. And things like smoking and other environmental toxins can be a factor. Of course, smoking would be something that would be very detrimental to your client and to you. Oh, yes, and the bladder decreases its ability to retain or expel urine, leading to more urinary infections. If any of you have a grandparent or older relative, especially one that's maybe been quite a bit older, that they may suffer from urinary tract infections quite a bit, and they can be very problematic, and they can lead to mental health and other issues. Just so you know, every once in a while, I have a client come back and they've been having a really hard time, and they will have had a urinary tract infection, and they will think they're going crazy. So all of these things are just really important to know. I often, if things are seeming off with someone and I know them, I will ask them to go see the doctor. I will say, hey, when's the last time you had your levels checked and like just had a checkup with the doctor and wonder if something's going on. Um, and sometimes that they lead to thyroid, they find out about urinary tract infection or something else. So really, really important. That prostate gland becomes an issue for men, um, can be the enlargement of that, and urinary incontinence for women because of pregnancy and childbirth and menopause. So it's just lovely, right? It's all just so lovely. Um, of course, decisions we make earlier in life can affect us later in life. The more that poor decisions we made early, the worse it will be for us later. So if we didn't take care of ourselves, it can be harder to take care of ourselves later. And there are different kinds of illnesses. They're acute, which are things like the cold and flu, and chronic, which are cancer and heart disease that never are cured, and you're just managing them. Interestingly enough, we don't know what coronavirus is. I mean, I know it's an acute illness, but it seems to be um, giving others chronic illnesses. I'm dying to know how y'all are doing on 7/20 when we meet for our group presentations at 5:15 on Zoom. So I hope you watch this lecture so you know these things. I think I'm going to do this all the time. I like to plug all this information in to make sure you actually are listening. But um, I'm looking forward to seeing all of your faces and seeing how you're doing. And I know that I know a lot of people with coronavirus, and I'm sure that a lot of you do too. No one in my inner circle or my immediate family, but certainly not far removed, like and certainly clients who have family members. I don't have a client who's had it. Maybe some of you have had it. I don't know. But I hope you are all well and healthy and okay, and that it's going okay for all of you. We know heart disease is the leading cause of death for men and women. Um, that metabolic syndrome, also known as syndrome X, it's about characteristics that really put you at high risk for premature death. So having high blood sugar, insulin levels, high blood pressure, low HDL cholesterol or good cholesterol, and a large waistline. Those are both genetic and environmental factors. Also, whether your parents had heart disease. Um, so, in children whose parents have heart disease are more likely to have heart disease later on. Um, they can be prevented with obviously going to the doctor and getting checkups and diet and exercise and all the things we hear about all the time. And then cancer, unfortunately, is the second leading cause of death. Lung cancer kills more than any other type, and it doesn't necessarily mean that you've had to have smoked. I've had several people I know that have lung cancer and never picked up a cigarette in their life. The most common kind of cancer is skin, and that's something that we can get checked regularly, like go get checked from the dermatologist. I do that every year. I didn't have to go back for 2 years this last time, but I go in and they look me over. Um, breast cancer for women is a high risk. So at some point in your career, you'll have a breast cancer survivor. You'll have clients who have cancer who come in to see you. And then prostate cancer for men, very common, and highly treatable. The good thing is with cancer, while it can be devastating to get this diagnosis, it's every day making huge strides for outcomes, especially with certain kinds of cancer. Skin, breast, even depending on the stage and the kind, and prostate can have really good outcomes for people. So positive, but mental health is so linked with these things, and you are going to play a huge role in helping people navigate this news and or issues that they're dealing with. Okay, let's see. Risk factors for, okay, now you remember, and I was looking for this on the quiz, but actually none of you said it really, but the average childhood experiences study. Do you remember that? ACEs, the longitudinal study really put out by Kaiser Permanente. 17,000 people were evaluated over a long period of time, and they came to find a dose response relationship with certain risk factors, adverse experiences in childhood, then leading to psychological, social, and physical problems later on. Groundbreaking, makes so much sense, right? So the more stress and trauma you have as a child, which includes low SES and other factors, right? Then later on, more physical, social, emotional health issues. And so health, obesity, drug use, etc., is indicative if you have more trauma in your history. So just a little interesting fact there. There's obviously more substance abuse for people who've had those issues in the past, and those contribute to health issues like heart disease and cancer. But interestingly enough, there are more deaths from tobacco than everything else just about combined. Isn't that interesting how toxic it is? And now we know that the vaping is awful and causing lots of those lung issues with a lot of the kids. And, oh my goodness. Isn't that interesting? I just kind of thought, wonder if it was COVID back then and we didn't know. Huh, maybe not, maybe it's probably not. It's probably the vaping. But the health risks of alcohol include long-term and immediate risks, right? And so the immediate could be the decision is made when they get in an accident, alcohol poisoning, high risk sexual behavior, DWIs. But the long term risk can be far more severe with liver disease and all sorts of mental health issues. Poor nutrition at any age is an issue and is a huge risk factor. Affects 1 in 3 people. And being active is really important. Eating disorders includes women over 50, so don't be careful that you don't stereotype that just adolescents would have an eating disorder. But there are ways to actually successfully age. I hope I'm successfully aging. But people in the health field and research all agree on 3 components. So 3 things you need in order to successfully age. Trying to avoid disease and disability. So that's prevention at every life stage. Trying to work at optimum health to prevent disease, which is healthy activities and nutrition and etc. Engagement and with life activities, connection. We know isolation is bad for health, and that's one of the issues we're having with this mental pandemic. It's difficult for people, and they've got to find a way to connect. Also, how are you going to deal with your child leaving home? Sometimes people put everything into their child, and their child leaves, and they're lost. And so, how do they reinvent themselves? How do they have purpose? How do they how are they generating, right? How are they feeling purpose in life? Maintaining that physical and cognitive health is of utmost importance. Eating good food. The gut brain connection is real. So, getting good foods, it doesn't mean you don't eat the bad foods, but making sure you're getting the good, healthy foods in your gut and being able to talk about that with clients is really part of health. And also getting active, walking, anything to get clients moving, get people moving. These are really important, good life decisions to give them a longer life. And it's never too late to start. Actually, was asked to go to an endocrinologist office, a large endocrinologist office that did a talk about this and ACEs and the trauma and in the early life and how that contributes to people not being able to successfully age and make these choices because of the negative cognition and feelings that are trapped inside of them that they can't move through. So anyway, it was really well received, and we definitely everything we do intersects with that. Cognitively, let's move into cognitive development. I just said that, but just so you know where we're moving. This is the cognitive, the thinking, right? We can have a lot of issues that affect our cognition, our ability to think clearly, and use our intellectual functioning. This can decrease, but there are definitely ways to make sure that it stays at its optimum level. But things like stress and menopause, mental illness, physical illness, things like that can cause it to not be at its optimum level. Try to be mentally challenged and intellectually challenged. Women typically are very strong in their spatial orientation, verbal memory, vocabulary, but show a decrease in perceptual speed before men. Men reach their cognitive performance before women in middle adulthood. Okay, information processing. Reaction times obviously going to slow down. Attention can be a little different. Midlifers maintain selective attention for familiar tasks. Focused attention does not show a decline. Sustained attention is the ability to focus on specific stimuli. And attention switching and divided attention. Age is a factor in more of the more complex the divided task becomes. So if we were younger, that divided task might not be so difficult. The divided attention is switching between two tasks simultaneously, such as reading a book and listening to the radio. The more complex that is, the more it declines with age. I've never been able to do that, so more power to you guys if you have. I can't do that. I have to fully focus on what I'm doing because obviously I have ADD. You just can't tell that already. All right, memory. We got memory, then we've got practical problem solving, wisdom, and intelligence. There's sadly a slight decline in working memory with age. Long-term memory is broken down into two separate types. There's implicit and explicit memory. Long-term memory can be further broken down into episodic and explicit. Wait a minute. Hold on. I said that wrong. I just said implicit and explicit, and then I was reading the episodic. Sorry. Further divided into episodic and semantic from implicit and explicit. Too many words. Older adults tend to have more problems with the episodic, which is remembering information or events when it's experienced from a specific time. The semantic is the basic information learned in school. It increases over lifespan, but we may have more trouble as older adults retrieving it. Definitely see that. Practical problem solving, wisdom, and intelligence. Practical problem solving is like everyday stuff, right? And people really excel in this area because they have a lot more expertise and knowledge. I have a ton of knowledge about practical life stuff. I am 42 and I've been working with clients since '05, and it's interesting. You learn so much every day from people. People are interested in things. People have hobbies and passions, and people are highly intelligent that come to see you and tell you about things. And I have learned a great deal about a lot of things from school and from people. I know just about enough to get me in trouble, right? But I do know you will, in 20 years after working, you will know a lot. If you are in your 20s or 30s, you will know quite a bit when you get to this age. Wisdom, so people who are seen as wise have a deep understanding of reality and the meaning of life and recognize what is good for them and others. So wisdom is something that we achieve, what we want to achieve, right? In middle to late. That's coming up, right? We want to be seen as wise. I would say wisdom is a beautiful part of getting older. And we know about the different types of intelligence, just like the memories and the memory. And make sure you just memorize those guys and just know them. We talked about them earlier, but these are always test questions. So fluid intelligence is the ability to think and reason abstractly. It does not decrease until about 60 years old. It's this ability is considered independent of learning, experience, and education. Fluid intelligence, like I said, it decreases with age, but not to 60. Crystallized intelligence is learning from past experiences and knowledge, such as reading comprehension and vocab. This intelligence increases with age as one accumulates knowledge and understanding. So, case example 15.2. When cognitive impairment is noted at midlife, the counselor should examine the client's lifestyle to determine risk factors such as smoking, menopause, stress, physical or mental illness. Do not conclude that age is the only factor contributing to mental decline. We should be aware of cognitive impairments caused by affective disorders that could have an impact. Another issue counselors should keep in mind is adults in midlife may be concerned about loss of short-term memory, known as episodic memory, which deals with remembering where they were going or where they put things. This is not an indicator of Alzheimer's, as many people fear, but more a sign of daily stress and pressure. Thank God. Midlife and mental illness. I've seen a lot of this lately, right? I think the pandemic has brought it out. It's quite variable. Um, Rates usually drop by 45, including those related to substance abuse and schizophrenia. Um, they may appear as peaks in stress and mental disorders come related to income level, age, and probably, I would say, marriage. I've had a lot of midlife issues right now because of the pandemic. But depression is by far the most common thing I see, and it's the most common form of mental illness for adults. Coping strategies really help. And you were wondering, where is that nugget of forum response? It's going to be in the reflection tonight. All right, let's see, which one do I want to use? I like this one. I like the second one. So disregard the first. I do think my ideal age is around 40. I've quite enjoyed my 40s so much, so brouhaha to that. What mental disorders beyond those described in this chapter are prominent in middle adulthood? How will you approach the treatment of mental illness in older adults differently from adolescents and young adults? That's your Forum for 15. Thank you for listening. I will look forward to talking to you again in the 16 presentation.